Welcome back. Right now we are going to focus on your health, specifically improving heart failure outcomes. Right now we have Dr. Ashkan Hayatdavoudi here from Presidium Health to tell us all about what we need to know about this subject. Dr. Ash, thanks for being here today. How are you?
Good morning, Christine. Thank you for having me.
So tell me what is important for us to know about heart failure, especially considering minority populations and improving outcomes.
So heart failure is a long-standing progressive condition that affects either the structure or function of the heart so that ultimately it can't serve its primary function, which is to pump blood into the body. It could present with a variety of symptoms, including lower extremity swelling, fatigue, and on the other end of the spectrum, shortness of breath, which is often related to increased risk of hospitalizations and ultimately a sign of disease progression. It's very important to talk about heart failure, particularly in the context of Black Americans, because Black Americans are at a higher risk of developing heart failure. They develop heart failure at an earlier age, and their outcomes are worse when they have heart failure relative to their white counterparts.
What is the science behind this? Why does that happen? In particular, why does heart failure affect minorities and Black Americans differently?
That's a fantastic question. There isn't a silver bullet answer. There's a variety of answers. There's common things that cause heart failure in all of us. Obesity, uncontrolled blood pressure, diabetes, prior heart attacks, coronary artery disease. These are all risk factors that lead to heart failure. Now, for, again, a variety of reasons, African Americans are at higher risk of uncontrolled blood pressure, obesity, and diabetes, which in turn increases the risk for heart failure. And then we have the factors behind the factors: economic disparity, access to information, access to housing and nutrition, access to care. Do you have access to a cardiologist? Do you have access to a primary care provider? All these factors play a role in disparities in healthcare, and in particular in this scenario in heart failure management.
How do you recommend that individuals manage heart failure?
There's certain things that we can all do. Lower our salt intake, increase our activity level, and take our medications as prescribed. For instance, I'm here with Novartis to raise awareness on racial disparities in healthcare in particular, and this scenario in heart failure and its management. And this includes medications. Well, medication Entresto is a prescription for adults with heart failure that improves mortality and reduces hospitalizations. It was specifically made for heart failure and has been used for various types of certain types of heart failure for the past 5 years. Now, the most important aspect of this is that your listeners should talk to their doctor about whether this medication, any other medication, is appropriate for them, and to come up with a management plan for their symptoms that's individualized to them. Because like any medication, Entresto isn't for everybody. You can't take it if you're pregnant. You can't take it if you're currently on an ACE inhibitor or an ARB. You can't take it if you've had a prior reaction of swelling called angioedema while being on an ACE and an ARB. So the most important thing is to talk to your doctor in relation to what is best for you.
What is the primary takeaway that you'd like us to remember from this conversation about heart failure? Where can we get more information and find safety information as well?
Yeah, in respect to more information, the good thing is as much of what I've said is on Entresto.com and in various forms. There's references and materials for information on heart failure, how to manage it, what to ask your doctor, what to look for, different treatment modalities, etc., in addition to safety information. In addition, in respect to takeaway points from this discussion, it's important to note that disparities exist throughout society. It's important to recognize those and address them. Healthcare is certainly not immune to this, and this is exemplified in heart failure. Black Americans are at higher risk of heart failure. They develop heart failure earlier and have worse outcomes than their white counterparts with heart failure. This raises the significance of raising awareness so that we can be more proactive in this high-risk population in the context of heart failure.
Well, thank you so much, Dr. Ashkan Hayatdavoudi, for joining us today with this important information about heart failure, how it impacts minorities and Black Americans differently and more, and what we can do about that. We really appreciate your time today. We'll be back with more right after this.